Hello everyone, I'm Dr. Soni here, consulting homeopath practicing at Kalwa. So today the topic of discussion is anemia. Let's understand what is anemia. Anemia is like there is reduced hemoglobin in your blood. So the oxygen carrying capacity of the blood is reduced because hemoglobin is the content in our blood which carries the oxygen to all the organs, all the cells of our body. So when this hemoglobin is reduced, we suffer from anemia. So what is hemoglobin? Hemoglobin is a content in the blood because of which the blood is red in color. And the main part which forms hemoglobin in our body is iron. And the supportive vitamins are folic acid and the other is vitamin B12. So these vitamin B12, folic acid and the iron, these are responsible for forming hemoglobin in our body. The major role is played by iron. So now let us understand what happens if we are suffering from anemia. It is like our skin is not looking that healthy. It looks pale. The face is looking dull, exhausted. Also, there is shortness of breath. Little long walk or little running will cause shortness of breath. Climbing the stairs or coming down in fast way, the patient will start or the person will start breathing and there will be shortness of breath. Children's like who are in the learning age, they will be very slow in learning, low in concentration. They will be easily fatigued. Writing 2-3 pages, they'll feel very tired. Even the women's, the main concern is during pregnancy and during breastfeeding. Women should have sufficient iron in the body. So that is the main part where in India, like women are suffering from this anemia and that affects their health. So these are the most common symptoms. Let's understand what are the foods we can include in our diet which help us to have this more iron which makes our hemoglobin. So all green leafy vegetables, like you can include spinach, methi, palak, chawlai, all the green leafy vegetables are very rich source of iron. Also, if you include some other foods like bajra, ragi, almonds, and groundnuts, these are also very rich in iron. So these foods are rich in iron, but our body needs to absorb this iron in order to make the hemoglobin. So if you include fruits like guava, like fruits which contain vitamin C, because vitamin C would help this iron to get absorbed in our body. So whenever you are having your meal, lunch or dinner, if you include one of the fruit after that, because once food enters, the iron will enter in the body, and the absorption of iron will take place with the help of these fruits which contain vitamin C. So this include guava, then oranges, and sweet lime, that is the mossambi. These are very important in absorption of iron in our body. Also, like there are few things which you should avoid. The main important thing is the tea and the coffee. If you are having tea and coffee, just make sure you don't take this tea and coffee 1 hour before and 1 hour after the meal, because what happens, there are some content in the tea and coffee which will prevent the absorption of iron in your body. That is, the absorption of iron will not take place in that such good content if you are having tea or coffee before and after the your lunch or dinner. And one important thing is that if you are non-vegetarians, then egg and any non-veg, they are rich source of iron and they easily get absorbed in the body. So this is all about what you should include in your diet. And I would suggest having one meal with green leafy vegetables every day would sufficiently fulfill your iron content. So make a habit of having one green in your meal. Maybe in breakfast, you can have the paratha of palak or methi or dhania. You can have chillas. You can prepare your own smoothies, adding some good fruits, banana, palak, and whatever flavor you like. Or in afternoons, you can have the palak paneer, then palak roti, or any, whatever you like to have it as per your taste and requirement. You can add one green leafy vegetable in your diet daily. Make sure that you teach this habit to your kids so that they from now onwards have the habit of having good food, healthy food in your diet. So this is the first uh, session of sharing some good knowledge. We'll continue with such sessions with some other topic and some good diet tips. Thank you for now.